A big issue that is in front of all of us now is now that we have these vaccines is how will they be distributed? We have the two people who have the most prominent roles, perhaps of all, in getting this done. Let me introduce first Major General Christopher Sharpston, Deputy Director for Supply, Production, and Distribution for the Operation Warp Speed, and Dr. Nancy Messonnier, the Director of the Center for Immunization and Respiratory Diseases at CDC, who leads the vaccine task force for the COVID-19 response. You both know that there has been some concern about the speed of the vaccine rollout. Many in our audience are expressing confusion about the process from vaccine production to getting needles in the arm. Can you please briefly explain the chain of events for us? And let's begin with you, Major General.
Reed, thanks very much. I do appreciate being invited to speak at this forum. You know, it is a whole of America approach the way that we're going after this. Operation Warp Speed is a public-private partnership. Our intent is to ensure that we can leverage not only the expertise of what exists within Health and Human Services, NIH, CDC in particular, and Dr. Messonnier will talk about that, but also the power that private industry brings to the capability in delivering a vaccine. So what we're doing is we're leveraging companies, pharmaceutical companies, pharmacies, hospitals, the places that deal with vaccines routinely every year are the same private industry companies and academia that we're using for this approach. Operation Warp Speed does remain 100% committed to the fair and equitable distribution of every vaccine dose that's available. And just so you're aware of the current numbers that we have out there, we currently have 48 million doses allocated out to the various jurisdictions, states, and territories. And we have distributed over 22 million doses with millions in transit over these next 2 days. And according to the CDC website, which Dr. Messonnier can address, right now we're tracking over 5.3 million doses have been administered into the arms of Americans. I'll pause there and kind of keep my my answers very simple at this point in time and go into more depth as we go further.
Good. Dr. Messonnier, would you carry the story forward from Operation Warp Speed, now moving on to how the CDC's role takes over?
So CDC works closely with Operation Warp Speed and the rest of the federal government, but importantly, CDC also works with every state and local jurisdiction, every partner, every community. The way that we're going to accomplish ending this pandemic through use of vaccine is having everybody on board working together. And that's why I'm so thankful to be here with you today. Your communities have been incredibly hard hit during the pandemic. And our mission to end this pandemic is going to take you. We can't succeed without you. We need everybody on board working together now in the future. And with this vaccine and all of us working together, I think Major General Sharpston and I are really confident that we can end this pandemic.
Great. So as we start to think about it, I would like you, Dr. Messonnier, and by the way, thank you again for being on every show that we have produced and the many town halls, and you are a stalwart of what we try to bring to the public. What we're seeing is so much variability state by state. And so I think it's one of the things that our audience needs to try to understand is how do you solve for the problem of working with 50 different states that each have their own mechanisms for connecting with the federal government?
Yeah, I'll start by saying that actually the numbers as of tonight are closer to almost 6 million people have now started their vaccination journey. That means 6 million people are now beginning to get protected against this virus who weren't a month ago. And I actually think we should celebrate that number as being remarkable. We're working with every state and jurisdiction to move as quickly as possible to make vaccine available to everybody. But do remember that these vaccines are slightly complicated. They're vaccines that providers haven't used before, and they're a little bit complicated in terms of storage and handling the conditions of the cold chain. And so many jurisdictions thought that, especially because we were launching this campaign over the holidays, they wanted to start slowly, the initial weeks of this, just to get some momentum coming. I really think that things are going to start moving much more quickly now. And, you know, I know folks are anxious to get to the vaccine. I think waiting your turn is hard. I can say that I'm still waiting my turn to get vaccinated. I hope that your audience will use this time to get educated about the vaccine and to help educate the community so that when it is your turn, you'll be ready and able to just roll up your sleeve and get vaccinated.
Great. And Major General Sharperson, what do you see then as the production schedule? When will we have enough vaccine for all Americans? And when will we be able to get out of this challenge of having to allocate, to make triage decisions as to which populations are priority populations that should get it before others?
Yeah, Reed, and as you lay out in your question, it really is a problem of supply versus demand. In the beginning, we do know that there's not going to be enough vaccine product available for every American that's out there. So to provide 330 million doses, up to 660 million doses if it's a 2-dose regimen, to all of America, it takes a long time for the production to ramp up to support that. Initially, we're assessing that we can get between 15 and 20 million doses produced by each Pfizer and Moderna each month going forward. There is a potential to ramp up production as they refine their manufacturing processes. But until we can bring additional vaccines online with future EUAs, right now that's kind of the pace that we're going to be going at. So we work very closely with the jurisdictions, as Dr. Messonnier mentioned, to really enable and assist their plans in vaccinating Americans. If we follow the ACIP recommendations, if we're going to go after healthcare workers,
explain what the ACIP is.
The Advisory Committee on Immunization Practices is a external CDC group that advises the CDC director on which vaccines should be used with which populations. And Reed, I know you're just challenging my my knowledge base. I'm learning very quickly. Dr. Messonnier schools me up every day, and that was one of the first things I learned from her, was how ACIP works.
The point is that one of the questions from our audience has been, please make sure that our speakers explain things in ways that the lay people can understand. You're doing a great job, Chris. Keep going, man.
Thanks very much. And so what we're trying to do is, clearly we're going to follow the ACIP recommendations first, healthcare workers, and then getting after the people in the long-term care facilities as part of our 1A population. For healthcare workers across the United States, we're talking about 21 to 23 million Americans. Looking at what vaccines are available right now, we believe it'll take upwards of a month to ensure that all of those people are addressed. And then as we start looking at the populations that are in long-term care facilities, that's about another 20 million. After that, we're going to get after essential workers and then on down the line with the special population groups. It's not our intent, and I don't believe it's any jurisdiction's intent, to approach these populations sequentially, one after another. I believe the best thing they can do is approach all of them in priority sequence, but generally getting after them in parallel as much as possible. So for the vast majority of Americans, as Dr. Fauci has mentioned, we do believe that by June, or April, May, June, we'll be getting after the vast amount of Americans that exist in the general population.
Thank you. Dr. Messonnier, we have a couple of quick questions that we want to ask you, really rifle shot here in terms of what our audience is asking for. Number one is, how long will immunity last, and how many times do we have to get vaccinated?
Boy, that's a great question. And sort of as you heard from several of the previous speakers, we have to follow the science. The science right now doesn't tell us. That's why we're going to be following people who get vaccinated for the long term, basically to see if at some point immunity runs out. I think it's possible, and most scientists think that at some point we may have to give some segment of the population booster shots, but really we just don't know that for sure yet. So let's focus on the endeavor right in front of us, which is getting that initial series into everybody.
And we also have a question about side effects. And can you explain side effects and versus what is a side effect versus what the vaccine is supposed to be doing to your body?
Yeah, I guess I would call a side effect something unintended that happens with the vaccine. The point of the vaccine is to stimulate your immune system so that you're ready to respond if you're again exposed to the virus. Side effects can actually have a broad definition. So frankly, if you get vaccinated and your arm is sore, that counts as a side effect. And we expect some of those side effects. In the clinical trials, some people did have sore arm and fatigue. Some people even had fever. And this was a little bit worse after the second dose than the first dose. But most of these side effects were mild, lasted only a day or two.
BlackDoctor.org, where wellness and culture connect.